Assalamu alaikum. My name is Javeria Khan and my roll number is BP1650101. For our pharmacy practice course 705, each one of us has been assigned to present a drug in front of you all. And the drug which I have to cover is Cisplatin. I will be sharing some important points regarding this drug, and one case study related to the use of cisplatin is also included for better understanding of uses, indications, contraindications, dosage, and other important aspects of this drug. First, let me give you a brief introduction of this drug. Cisplatin is a drug which is used as chemotherapeutic and anti-cancer agent. It is a non-classic alkylating agent which contains platinum. Cisplatin was discovered through an observation that neutral platinum complexes inhibit cell division and growth of Escherichia coli. Now, if we talk about its mechanism of action, a lot of research has been carried out on the mechanism of action of cisplatin, and it has been concluded that it stops the proliferation of cancer cells by binding to cells' DNA. Due to this binding, the structure of DNA changes and it leads to destruction of DNA. Cisplatin is administered in the form of IV infusion, and it is a prodrug which gets activated once it enters the cancerous cells. It produces its effects by binding to 7th nitrogen of purine of DNA, that is guanine. Other than guanine, interaction with 3rd nitrogen of adenine and 6th oxygen of cytosine is also possible. This binding occurs because DNA base has nitrogen with lone pair of electrons, while our drug cisplatin is electrophilic in nature, which quickly binds to nitrogen of DNA base. This damages the DNA, blocks cell division, and result in apoptotic cell death. In this slide, there is just a visual representation of how cisplatin binds with nitrogen of the DNA and leads to change in the structure of DNA. Here, this is platinum of cisplatin, which forms bond with nitrogen bases present in the DNA. Here it is the bond formation with adenine and guanine. The linking can be either interstrand linking, as interstrand linking is shown here, which is between two different strands of DNA. Or it can be intrastrand cross-linking. This is intrastrand cross-linking, which is bond formation with a single strand of DNA. Now let's talk about rational uses of cisplatin. Cisplatin has been effectively used for the treatment of many different types of cancers. It is part of regimen in various different lymphomas, ovarian cancer, metastatic cancer, multiple myelomas, melanomas, etc. It has also been found effective in the treatment of testicular cancer, esophageal cancer, small and non-small cell lung carcinoma. Other than these, many other different forms of carcinomas are also included, which I have mentioned in this slide. Now, I'd like to shed some light on the irrational use and side effects of cisplatin. Irrational use of cisplatin, like any other chemical substance, can lead to many harmful effects. Cisplatin is a very active alkylating agent. For this reason, we have to use cisplatin mindfully. Its irrational use can lead to many side effects, which can be life-threatening as well. For this reason, the uses, prescription, distribution, and marketing of cisplatin are well defined in WHO guidelines. Irrational use of medicine is becoming a widespread problem due to irresponsible prescription of drugs. Side effects caused by cisplatin can include nausea, vomiting, which is due to destruction of cells of GIT. Other than this, it can also cause ototoxicity due to its effect on cochlea, while other side effects include kidney toxicity, blood test abnormality, loss of appetite, hair loss, peripheral neuropathy, etc. So in this slide, I have mentioned different doses of cisplatin for adult and geriatric population, which is used in the regimens of different carcinoma for treating various different types of cancers. As you can see from this comparison, the doses are same both in adult and geriatric population. I have mentioned the doses for bladder cancer, testicular tumors. So in the continuation of the previous slide, in this slide, I have covered some more cancers in which cisplatin is one of the main drug in the regimen, along with the doses of cisplatin used for each type of carcinoma, like metastatic ovarian carcinoma, cancer of cervix, kidney, small cell lung carcinoma, etc. So cisplatin is also used in pediatric population, and one of the main use is for the treatment of osteogenic sarcoma and recurrent brain tumor, and it has shown effectivity in both these cases. Again, I have mentioned the doses that are used in their respective regimen, like for brain tumor 60 milligrams per meter square IV, for 2 consecutive days, 3 to 4 weeks, and etc. Okay. So while using cisplatin, there are few considerations that have to be kept in mind, and we have to take proper measures to avoid side effects. These considerations include pre-treatment hydration for patient, and it is achieved by giving 1 to 2 liters of fluid 8 to 12 hours before the dose. In case of renal impairment or renal insufficiency, dose also have to be adjusted. Dose is adjusted in a way that we will check creatinine clearance of the patient. If it is 10 to 50 ml per minute, then we will decrease the standard dose by 25%. And if creatinine clearance rate is less than 10 ml per minute, then we will have to decrease the dose 50% of the standard dose. And now let's talk about the available dosage forms of cisplatin. The only available dosage form is in the form of IV infusion. It is administered through intravenous route. Cisplatin is a very strong alkylating agent, and if given orally, it can lead to destruction of cells of GI tract. Hence, it can only be given in the form of IV. In this slide, I'd like to talk about interaction of cisplatin with some other drugs. First, what is meant by interaction? So interaction means that if you will administer that particular drug with any of these mentioned drugs, there will be some drug-drug interaction, which can either lead to decreased effect of cisplatin or it can cause certain side effects. So our first drug is amphotericin B deoxycholate. If it is administered along with cisplatin, it can cause nephrotoxicity or ototoxicity or both. Same is the case with the drug bezitracin and cidofovir. When these are administered or given with cisplatin, or even if they are administered, if cisplatin is still in our body plasma, it can lead to nephrotoxicity or ototoxicity or both. Influenza virus vaccines, both quadrivalent and trivalent, can antagonize the effect of cisplatin. And due to this antagonism, there is decrease in activity of cisplatin. Drug pelifermin can increase the toxicity of cisplatin, means the side effects will be enhanced and we will observe more intense side effects of cisplatin if it is administered along with parafermin. Interaction of drug selenoxer with cisplatin is still unspecified and we don't know the proper interaction. The drug tefenoquine can increase the effect of cisplatin, means the pharmacological effect of cisplatin will be enhanced. Same is the case with trilaciclib, and it also increases the effect of cisplatin just like tefenoquine. Alternative drug options to cisplatin. Sometimes when we observe extreme side effects and it becomes harder for our patient to bear these side effects, we have to substitute cisplatin with some alternative drug. So carboplatin is one of the drugs that can be used in place of cisplatin. It is a second generation analog of platinum with less severe side effects as compared to cisplatin. Although it has same mechanism of action, mechanism of resistance, and pharmacology, but it causes significantly less renal and gastrointestinal toxicity. Only toxicity caused by this drug, due to which we may have to limit the dose, is myelosuppression. Another advantage of using carboplatin is we do not need intravenous hydration as it is necessary when cisplatin is part of our regimen. All these properties make carboplatin much easier to administer to patients and hence replace cisplatin in many chemotherapy regimens. And this oxaliplatin is another drug which can be used as an alternative of cisplatin. It is third generation platinum analog and it has same mechanism of action and pharmacological properties as cisplatin and carboplatin. Another advantage of using oxaliplatin over other platinum analogs is that it is effective against tumor that are resistant to cisplatin and carboplatin. Due to this reason, it is also used in regimen against colorectal cancer. But one major side effect shown by oxaliplatin is neurotoxicity, and we have to limit the dose if neurotoxicity is observed in patients. Now, after discussing the two of the cisplatin alternative in details, I would like to mention few other drugs that are available and are sometimes used as an alternative to cisplatin. I have mentioned the name of those drugs in this slide, and these include 5-fluorouracil, cetuximab, and docetaxel. So we have already established that the only available dosage form of cisplatin is in vial for IV administration. But even in this single type of dosage form, it is manufactured by number of different pharmaceutical companies. They make different brands of cisplatin, but the packaging is same for all the brands, that is glass vial. But there is difference in strength of the preparation and prices. In this slide, I have mentioned the name of those pharmaceutical companies that make cisplatin along with the brand names. For example, here Cisplatin. It is made by Pharmadic Private Limited in 3 different concentrations, which include 10, 25, and 50 milligrams per ml. And they have different price range, ranging from 120 rupees to 523 rupees. Next, we have Cisplatin by Atco Laboratories Limited. They have 2 strengths of cisplatin available, which includes 50 milligrams per ml and 100 milligrams per ml. Their price point is a bit higher than Pharmadic Private Limited. Their 50 milligram vial is available for rupees 834 and 100 milligram vial for rupees 1400. Few other options include Cisplasol by Pfizer Laboratories, 50 milligram vial for rupees 1247. Their price is highest among all the available brands of cisplatin. Others are Cisplatin by Biopharma, Oncoplatin by Consolidated Chemical Laboratories, Cisplatin by S. Ijazuddin and Company, and Platocene by Turner Grahams of Pakistan Private Limited. There are many more brands available, but here I have only included the names of few among them. Antidote for cisplatin. In few cases, there is possibility that we may have given an excessive dose of cisplatin, or the person has received the normal standard dose, but he is renal insufficient. So the drug stays in the body for a longer period of time, or it can get accumulated in the body and lead to toxicity and side effect. Another possibility is that pharmacist or doctor has not calculated the dose properly, which leads to drug overdose and toxicity. Paradoxin is one of the drugs that can antagonize the action of cisplatin and decrease its effect by drug-drug interaction, but it is not commonly used to treat cisplatin toxicity. However, there are few actions that can be taken by physicians to help eliminate the risk of cisplatin toxicity. The first one is to enhance the elimination of the drug. As more amount of drug will be eliminated through different routes from the body, the toxic effect of the drug will decrease. This can be achieved by giving aggressive intravenous hydration with or without use of osmotic diuretics. If a person has cisplatin toxicity, all those drugs that can cause nephrotoxicity should be strictly avoided. While taking all these precautions, the doctor have to make sure that the laboratory parameters of the patients are within the required range. Any variation in the laboratory results may indicate that the condition of patient is getting worse and immediate treatment is required. There are few experimental therapies for cisplatin toxicity as well, which include drugs such as amifostine, acetylcysteine, fosfomycin, cholesterol, but these drugs have shown very little effectiveness in clinical trials and are still under investigation. Next, I have included a case study where we will use cisplatin to treat hepatic cancer effectively. So I will discuss case study in the form of soap notes. First, discuss subjective part. Gender of the patient is male. He is 64 years old, and the chief complaint due to which he has come to the doctor is epigastric and right hypochondrium pain, and which is associated with anorexia, due to which there is weight loss. Means the patient is suffering from pain in the region of upper abdomen immediately below the ribs. There is pain in right upper quadrant under the ribs, which can be due to problem in gallbladder such as gallstone, or it can be due to presence of gallstone in bile duct or cholelithiasis. This pain is usually felt after a large meal or in the evening. This pain is causing anorexia, means patient is unable to consume food, and due to this anorexia, there is weight loss. Patient has already been treated for the symptoms, which include gastric reflux and hiatal hernia. Hiatal hernia means stomach bulges into chest through the opening in the diaphragm muscles. Physical symptoms include performance status level 4. Performance status indicate level of functioning in the patient, and level 4 means patient is completely disabled. Patient is also suffering from jaundice, paraneoplastic fever, which is caused by cancer, and also patient has abnormally large liver, which is causing severe pain and probably is the reason for the jaundice too. Now discussing objectives. Patient was previously given proton pump inhibitor for the treatment of gastric reflux and hiatal hernia. Patient has increased level of LDH, which is levated dehydrogenase. It is an enzyme found in all the cells of the body and are involved in the energy production of the body. An increase in lactate dehydrogenase enzyme can indicate liver disease, anemia, heart attack, muscle trauma, cancer, bone fraction, or infections. Level of aspartate aminotransferase is also 2 more than the upper limit, which indicates liver damage. There is also cholestasis due to jaundice, which means flow of bile from the liver is reduced or blocked. Lab results are indicating that the level of bilirubin is greatly increased, which again points towards some liver disease. Both carcinoembryonic antigen and cancer antigen are normal. Normal level of cancer antigens indicate that there is not enough possibility of pancreatic cancer, as in pancreatic cancer level of CA are elevated. While normal level of carcinoembryonic antigen indicate that the cancer is not growing or spreading to other body parts. Another indication of liver disease or liver cancer is the patient's AFP level is elevated. AFP means alpha fetoprotein. It is a tumor marker, which are substances made by cancer cells or by normal cells in the response to cancer in the body. High level of AFP indicate liver cancer or some non-cancerous liver disease such as cirrhosis and hepatitis. Here, ostrogastroduodenoscopy show ulcerated tumor lesions, and ultrasound and CT scan confirms that the lesion is in the right liver. Ulcerated lesions are indication of type 2 gastric carcinoma. Next, we have done histopathological examination of cardiac part of stomach, which shows groups of nodules, which are tubular glands made of large cell with large nucleus and eosinophilic cytoplasm indicating infection. Biopsy of hepatic cells shows same feature as that showed by cardiac cells, but there is more necrosis in hepatic cell. IFSC, that is immunohistochemistry studies, which is involved in identifying antigen, show CK19 as positive, and this CK19 positive indicate that the patient has hepatoid adenocarcinoma metastatic to liver. CK19 can help us distinguish between hepatoid adenocarcinoma, in which CK19 have positive value, while hepatocellular carcinoma CK19 has negative prognosis. Cytokine 7 is negative. Other cancer markers such as CD10, chromogranin, and anti-synaptophysin are also negative. Now, if we will assess all the labs and radiographic result, we can reach some conclusion as to what patient is suffering from and then prescribe the drug accordingly. The lab results, ultrasound, CT scan, and estrogastroduodenoscopy all indicate that the patient has some hepatic or cardiac disease, means patient has some infection in the liver or in cardiac part of the stomach. Next, when we perform biopsy of cardiac and hepatic cell, the results showing tubulopapillary cells with large nucleus and eosinophilic cytoplasm indicate that the patient may have hepatic carcinoma. Finally, the disease was identified by performing ICH test, which confirms that the patient is suffering from hepatoid adenocarcinoma with liver metastasis. The main diagnostic feature was positive CK19, which indicated towards metastatic hepatoid adenocarcinoma. As a treatment plan, we would include cisplatin in the regimen as it has shown efficacy in metastatic hepatoid adenocarcinoma in many clinical trials and case studies. Finally, we will prescribe and make a plan for the patient, which will include cisplatin 25 milligrams per meter square with etoposide 100 milligrams per meter square each day for day 1 to 3. And this will continue every 3 weeks for 2 months. And etoposide is also an anti-cancer chemotherapeutic drug. It is also used for cancers including testicular cancer, lymphoma, leukemia, ovarian cancers, etc. And with this plan, we are expected to see 80% reduction in liver metastasis after completion of 6 cycles of cisplatin and etoposide. In this last slide, I have mentioned some references from where I have taken this text and information from. Thank you.